Yeah, so in the past, we would just treat the skin. We would either beat up the skin by using some kind of acid, like salicylic acid, or cryotherapy. These are therapies that have been around for more than 50 years, and the success rate has been great, to be quite honest. And that was just treating the skin, or even if we were to excise the lesion, the recurrence rate was really super high. So now we're utilizing the Swift treatment, which actually attacks the causative issue. Instead of worrying about what it is, it's a wart. Why is it? It's a wart because it's an HPV virus. Now we're attacking that HPV virus. We're uncloaking it and letting our own immune system fight it. I'll be honest with you, in the past, I was always kind of frustrated when I would see on my schedule that there was a patient coming in with a wart, because I would say, what am I going to be able to tell this patient honestly? How am I going to really get them better? And I knew it was like a process. We would, like we said, we'd give them medications, we would freeze them, we would maybe cut them out, and then there was always a recurrence, or there was a situation where it's not compliant. So that was very frustrating. Now I see a patient comes in and has a wart, I'm kind of energized. It's time to move forward and do things that are really going to make positive outcomes for your patient.
Yeah, no, fantastic. Okay, here we go. Good evening, everyone, and welcome to Making Waves, a webinar dedicated to how Swift can impact your patients and your practice. Now, the gentleman you saw on that clip was Dr. Rob Conanello from Orangetown Podiatry, and we wanted to share that video up front because it really sets the stage for tonight's discussions. As Rob, I think, astutely puts it at the end of the clip, tonight is all about moving forward. It's about inertia. And if we want to tie it into our title and into our technology, it's really about making waves. Now, for those of you who don't know me, my name's Pete Turnbull. I'm one of the founders of Certia, and we are the US distributors of Swift microwave therapy. Now, as you will see at the bottom of the screen, I am joined by 4 individuals who make up our expert panel, who I am honored to be able to introduce. So first off, we are very pleased to welcome one of the earliest U.S. Swift adopters, who we fondly like to refer to as the Wart Wizard, and that's Dr. Alec Hochstein. Welcome, Alec.
Good to see everybody on.
We're also extremely thankful to be joined by someone who we view as being not only a great doctor, but just a great guy, and that's Dr. Alan Bass of Central Jersey Foot and Ankle Care. Welcome, Alan.
Well, thank you very much, Pete. Pleasure to be here.
And our third guest is Dr. TJ On, who provides us with a very unique perspective, as he's only recently made the decision to invest in Swift, and will be actually launching his Swift program in the coming weeks as we emerge from the pandemic. More importantly, he's a marketing guru who runs an impressive private podiatry practice, but also just within the last 12 months, launched a rapidly growing professional coaching business for podiatrists. So welcome, TJ.
Thank you. Thank you for having us. Thank you, Pete.
And then last and definitely least, acting in the role of co-facilitator of this evening's discussion is my business partner and longtime friend, and that's Chris McNamara. Welcome, Chris.
Thanks, Pete. Happy to be here. Welcome, everybody.
Alrighty. Now, no matter what the industry or application, every truly great product needs to solve real problems. Tonight, we're going to talk about Swift as a tool that you can add to your toolkit that will allow you to see problems in a whole new light, in a way that gives you the power to solve those problems by doing things differently. So how do we plan to do that? Since we launched our business in January 2019, we've spoken to hundreds of podiatrists and have collected several key insights. But there are 2 really in specific that have really resonated with us. Number 1, almost no one who is honest with themselves and their data is seeing consistent outcomes with their current wart therapy. And number 2, almost everyone feels like they're working harder for less. These are the challenges we really want to dive into in this webinar. We'll understand them in depth, and then we'll shift our focus to how Swift can help with those challenges. Now, these 4 items will drive the flow of our discussions. However, our goal is to ensure that you, the audience members, have your specific questions answered. This session's all about you, all about your businesses. So we're going to keep this session as interactive as possible. Chris, do you want to take them through the questions and polls?
Absolutely, Pete. So now I'm just going to direct your attention to the right-hand side of your screen. Well, you'll see 2 primary tabs, questions and polls. Questions are to be created by you, so please fire away as you see fit. The poll questions will be released as we work through the discussions, and we'd like to start now with our first one, which is, drum roll, what are you hoping to take away from this webinar? If you can complete that now, we would appreciate it, as it will help us guide the focus of the discussions.
Brilliant. So I'll just let everyone take a sec to answer that question, which shouldn't hopefully be too skill testing, but it will actually help us focus the conversation. So if there is something that we see is more pressing for the audience, then we'll certainly shift the dialogue. We've got a slide deck. We'll stick to it, but if the conversation takes us down a different path, then we'll go that way. Okay, so I'll start by taking a deep dive into what is considered to be the bane of existence for almost all podiatrists and dermatologists across the planet. This is a snip from a case study on warts and microwave therapy written by ours truly, Dr. Alec Hochstein, which was recently published in Podiatry Management. Now, Alec, you start the case study by stating right up front that plantar warts can be particularly resistant to treatment, and up to 1/3 of them can recur after being treated. Can you explain why that is and why warts are such a pain to treat?
Well, sure. I mean, look, I think I'm pretty much preaching to the choir here with these podiatrists. I'm sure everyone on here has seen this and knows what I'm talking about. I mean, verruca are on the outermost portion of the skin layer. They're not super, readily available to our immune system. So they kind of sit there cloaked, and our antibodies don't generally see it the way they present in a plantar wart. So patients, they don't even know what's there. They don't have a reaction to it until it gets large enough or it's painful or an astute mom goes and finds it. So they can sit there for long periods of time. And I'm sure we all have patients where they left for camp after school, didn't know they had it, and come back, and now they have multiple ones, and they spread them to their entire camp because they're contagious, and the patients don't know they're there. So they're very difficult to treat for that reason, and it's hard for the body to recognize them, and so they sit there for long periods of time.
Yeah, brilliant. Now, Alan, I remember it was solving that patient frustration that was your primary motivation when we first met at the AAPPM in Daytona. Can you tell us about that particular patient we were speaking about and how their journey impacted your decision to invest in Swift?
Yeah, sure, Pete. So the funny thing is, I had been seeing advertisements for Certia and for the Swift technology on Podiatry Management and PM News, and I had heard about it, and like most of us, the attendees on the webinar or the panelists, we all have these patients. And right before I had come to Daytona, I had been treating this one patient, and I believe you have the slides a little later on in the presentation. And this gentleman had interdigital warts, and it was just very frustrating, especially for the location. And no matter what I did, no matter how hard I tried to treat it, I was on a hamster wheel with this patient, and I was just going nowhere. And I just couldn't figure out what is the best thing. Excising them interdigitally, there's not a lot of skin there, and it's tough. Topical treatment, again, not a lot of skin there. So my options were very limited. And when I finally, when I was at the conference and I ran into you and Chris, it was almost like that light bulb went on. And it said, I think this is it. I think that it's not about treating the wart, but now about treating the underlying cause. And that's really what drove me to really do a 180-degree turn in how I thought about treating this patient.
Great. That's great, Alan. Alan, we have a question that has come in. It's probably an appropriate time. It's
Sure.
Is this a painless treatment, and how long and how many treatments need to be done? We're going to get into protocol, but just if you can comment on the pain factor, maybe at this point.
Sure. Well, and we'll get into the treatments, I believe, and again in a few slides. So this is, I like to describe the way this feels to my patients as a rubber band snapping against the skin. While we get because when the physician learns about it, we talk about this increase in thermal energy, this increase in heat that's going to happen, and I don't want that to scare the patient. So I talk about what does it feel like if you put a rubber band on your wrist and pulled it and gave it a snap? What does it feel like? Well, you get that rapid feeling of something, and then it quickly dissipates. And really, that's what it's about when using the Swift technology. It's this pinch, this snap, but really what it is this quick raise in temperature. I do not use any type of anesthesia with this because the rapid increase in temperature and rapid decrease in temperature doesn't warrant using any type of anesthesia. And all the patients that I've treated since I've implemented Swift, not one of them has said to me, wow, I wish you would have given me some anesthesia, wish you would have numbed me up or warned me what it would have felt like before, because to every patient, it's been a very good experience.
Perfect. Thanks for that feedback. Hopefully that
Sure.
answers the question. So I don't want to belabor the point because I think most people are in agreement, but I do want to pull the audience on this. I think Andy just put the poll in. The question is, how would you rank your frustration level with your current wart therapy? And I'll pass it on to you now, Pete.
Yeah, great. I'll just give everyone a second to answer that question. And then we will shift gears slightly. Actually, Andy, if you can move forward into that next slide. That's our transition slide. Yeah, perfect. So we will shift gears from the wart problem specifically into now what we call the profit problem. And I want to take us back to the commentary we hear from many providers we speak to, which is every year I feel like I'm working harder for less, which really got us thinking about practice performance and practice efficiency through a different lens, which we feel is captured, really nicely in this slide, which actually was courtesy of Rem Jackson. Rem, if you're on tonight, thank you for this. Now, what we've realized is there's a huge variation across the country when it comes to revenue per hour, driven primarily by practice management differences. And what you'll see here is two key takeaways for us anyhow. Number one, you have to decide what kind of provider you want to be. Everyone will be different because you've all got different goals. But number two, we all need to move on from the thinking that bigger is better. Simply adding more patients will not yield better performance or get you closer to your personal goals. So it's setting some context and some framework for thinking about your business differently, which is where we want to go with this next discussion. Now, someone who knows this better than anyone is Dr. An. And TJ, this snip was taken from a recent interview you did with the folks at the Morning Blend in Las Vegas. Now, can you take us through the discussions during that interview and maybe speak to how you've transformed your practice over time?
Yeah, well, thanks for inviting me here. I sent, by the way, email list of my group and doctors who are in our membership. I see already over 30 doctors joined in this webinar. So I appreciate, guys. Shout out to you. Podiatrists and even just private practice in general, we have to think differently. Whenever we talk about mindset shift, we all think, oh, woo-woo again, universal frequency. But we do, because I talked about this yesterday in my training call that, Darwin and all that evolution, I don't know who believes in that or not, but survival of the fittest, when environment changes, there are two ways to survive. We need to adapt to new environment, or we need to be so different and distinctively disruptive and different so that you stick out. And you need to kind of apply yourself if you want to survive and thrive to this new healthcare trend, which is, I'm sure we all agree, the insurance reimbursement keep going down. Hospitals and big network, they're gulping up small practices and small, the clinics. I refuse that. People need private practice and quality care, concierge style. So when these things happening around 2014, I started looking differently. Either I give up podiatry and start my Korean barbecue franchise restaurant, or, we need to adapt to this environment and survive. So I started looking into what other doctors do, like plastic surgeons, orthodontic, like plastic, dental industry. How do they survive? People seem like acting like they don't have money, but I did my research. That's not true. So since 2014, I started looking, okay, how can we survive and thrive? We need to start looking differently, start opting out of bad insurance plans for doctors, and then start slowly building, not completely overnight, but that's what I did. Slowly opting out of bad insurance plans and start adapting cash pay practice into my model, still accepting, certain insurance plans. So I call it hybrid concierge, and it's been working great for me and doctors I help.
That's great, TJ. Thanks for that. And on that note, we've just posted our next 2 poll questions. First, what percentage of your practice is currently cash or elective pay? Second, do you plan to offer more cash pay services moving forward? And as we wait for that, I do see a number of questions coming through, and some of our sales consultants are working diligently at responding to those. The questions that have come up so far, I can assure you we are going to answer in the coming minutes throughout the presentation. So if you can just hang tight, we'll be there in just a few minutes.
Yeah, brilliant. And I will direct everyone's attention to TJ's book, Opt Out, which is a great resource. And we'll actually be raffling off some copies as a follow-up to this session. So that really summarizes the challenges. 1, inconsistent and ineffective wart treatment, and 2, a reimbursement environment that's eroding profitability. And that really leads us into Swift as a way to approach these challenges in a very new way. So for everyone who hasn't seen it, this is Swift. And for the sake of time, we're going to stick to the basics. If anyone does want to dive deeper on the system itself, we will be offering everyone the opportunity to book a live or virtual demo towards the tail end of the webinar, so don't panic. But let's begin. So Swift is the smallest medical microwave generator in the world. In terms of mechanism of action, it uses non-ablative, non-destructive heat to stimulate an immune response. So we're not trying to destroy the lesion, as Alan and Alec were saying, but we're purely alerting the body to the presence of HPV. We call it uncloaking the virus. Now, because we're simply stimulating the immune response, we fall outside of CPT codes for benign lesion destruction, making Swift a cash or elective pay modality. The primary application to date has been viral warts, and since 2016, we've completed more than 70,000 global treatments with greater than 85% real-world efficacy and less than 1% recurrence. Now, lastly, we received our 510K clearance in November 2018, which is why it's new to not only yourselves, but to the entire US podiatry and dermatology markets. Now, before we get into treatment and protocol specifics, we think it's really important to understand the journey of a wart patient. And this was a foundational insight that we uncovered once we started to speak directly with patients that were being treated with Swift. The question we were trying to answer was, how many patients coming to a podiatrist with plantar warts as their primary diagnosis would be classified as recalcitrant, i.e. 2 or more prior failed treatments? We found out 2 things. Number 1, most patients confirmed that by the time they saw a podiatrist, they'd already seen 2 other physicians. And number 2, greater than 90% of them had 2 failed treatments or more previously. So what this told us that nearly all wart patients, when they arrive at the podiatrist's office, are deemed recalcitrant. And when they get to your office, they're frustrated, and they end up bouncing around between podiatrist and this dermatologist. And this is the frustration zone that we're talking about. When they're coming to you, they're looking for specialized treatment. They're looking for something different to what's already been done that hasn't worked for them. And it's just really important to hammer that point home, because it does explain a lot of the rationale for both profitability and acceptance within the patient. Now, as far as the SWIFT protocol is concerned, Alan, do you want to walk us through how you explain the treatment regime to your patient?
Sure. So while I have really focused my practice more on using SWIFT as a primary mode of treatment, I do speak with patients about other ways to treat it, but I do focus this more because I'm able to speak more confidently on the outcomes. So when they come in, I explain to them that this is, while the treatment itself will be 3 treatments at 4-week intervals. So at day 0, day 30, day 60, which is 3 treatments, I make them understand that we are not treating the wart. Again, I have to stress that to everybody on here. It's not ablative. We're not doing anything to destroy the wart. This is, as both Alec and Pete have said, this is an uncloaking of the HPV. So while it's 3 treatments, the entire protocol is actually 12 weeks. It's a 6-month treatment. So I treat them for 3, and I follow them up at month 4, and then again at month 6. So making sure they understand that we're dealing with the immune response to that, and I explain to them about how warts, what a wart is all about, that it's a virus, and what the body is now going to do in order to fight off the virus as opposed to destroying the skin. So like I said, I explained to them that each treatment is, like I said, almost like a rubber band snapping. This and the SWIFT technology has different settings depending on the severity of the wart, and it goes anywhere from 0 to 10 watts. And depending on the severity and the thickness of that skin, at the beginning, you'll notice that the treatment settings are higher, and we treat it for 2 seconds. Now, think about the diameter of the actual applicator is about the size or maybe a little bit bigger than a pencil eraser. So think about the diameter of the wart, and then actually, if needed, divide that wart into quadrants. Because remember, it's not about covering every little surface area with it. So I tell the patients that if it's small enough, I'll just treat, the application will be 5 2-second applications. So in theory, the entire treatment is 10 seconds. And if it's a little bit larger, I might divide it into 2 separate areas. So as this picture will show, depending on the size, and you can see right near that the arrow that we would use to hit play on the screen is the actual tip. And that tip itself is the diameter of where the impulse comes out of. And remember, and I try to explain to the patients that what's going to happen is this is a very low depth. It doesn't go very far into the skin, and it doesn't scatter. It doesn't go in different areas. So it's going to penetrate very shallow, but straight down. That's why if I need to, I'll take that wart and I'll divide it into 2 quadrants. Even if it's very big, I might divide it into 3 or even into 4 quadrants. Yep. And it's a relatively quick, painless treatment. And once I try to give them the visual of or hearing that it's that rubber band snapping, they feel real comfortable understanding what's going to happen next.
Yeah, brilliant. So what we'd actually thought we'd do here, we actually have a treatment video, so we can show this, just to give everyone a perspective of what it actually looks like, because it's sometimes hard to conceptualize. So this is actually a video from Alec. There's no audio here, Alex. So if you could run through this, Andy, if you could start this from the beginning, actually, and just let Alex speak to what's happening here during the treatment, that would be awesome. Take it away, Alec.
Sure. Basically, I'd love to make this a big deal and tell you that this is a huge learning curve, but thankfully it's not. You can be an expert in this the first week that you have it if you have enough warts. Basically, this was a solitary lesion in a very bad area underneath the first MPJ. And you can see what I'm doing is I'm pulsing it. You can see that little green light just right there under my thumb. That means we have pulsing going. I like to remove the wand, as I like to call it, from the lesion every time I pulse. So what I'm not wanting to do is continuously push into the tissue. I use every pulse as a reset. So it's literally 2 seconds and I'm off, 2 seconds and I'm off, 2 seconds and I'm off. And I keep doing that. And generally I do it 5 times. We don't want to get too deep in the weeds here as far as dosages, but just for completeness sake, I typically do 8 watts at 2 seconds, 5 times. If I have somebody who's a little different, or I don't get the tissue response that I want, let's say at the second treatment, I can tweak that a little bit. And I've done enough of these at this point to know that I can do that. But that's what you're seeing in the video. What you just saw is a typical treatment. It's no harder. Nobody on this panel does it any differently. Nobody will ever do it differently because that's the way you do it. And that's how you get results.
Yeah, fantastic. And so as you can see, we're not breaking skin or destroying tissue. So there's no open wound, no plume, no need for bandages or dressings. So what this means for patients is once they leave the office, they're straight back to karate, gymnastics. They're back in the pool. They don't have to avoid the shower. There's no patient downtime as a result of the treatment. Now, like, how do you position Swift relative to other treatment options when you're discussing this with your patients? That's often a question we get. How do you position it, relative to others?
Yeah, it's interesting. So I know there's people probably on here right now saying, "Well, I don't know if I can do this. I don't do cash pay. It makes me nervous to ask for money from my patients." Here's the deal. I practice in a very congested area. I'm from Long Island. There's a podiatrist, a few blocks on every block, there's a podiatrist. I'm a new patient. I like to adopt new technologies. Here's the thing. Once I got comfortable with this, and I didn't have anybody to speak to like you guys have. I didn't see a webinar. I didn't have anyone I could call. I literally was like, all right, look, I can't believe these guys would be lying and coming to me with this. So I'm going to take a leap of faith here. Once I got 3, 4, 5 patients coming in at that second treatment and the wart was gone, I flipped the switch and was like, this is the only thing I want to do, because I could look the patient in the face and say, look, I'm going to get rid of this wart within 2 to 3 treatments. This is what it's going to cost you, but it's going to be gone. And then once you guys came out with the other studies, which again, I don't want to get too deep in the weeds, that the recurrence rates on Verruca were decreased after jumpstarting the immune system with respect to the HPV on the foot, it's a no-brainer. So as far as how do I position it, I position it number one. I don't withhold treatment from my patients. If a patient cannot afford it, if a patient does not want to go for that, I'm not going to not treat them. So I still have cantharone and hypercation and, excision and all those things that I hate doing at this point. So my number one is Swift, and that's what I lead with all the time.
Yep. And I know there is a cost. Alec, how do they react when you tell them it's out of pocket? What sort of percentage go for Swift versus not?
I'm at an 85% conversion rate to my cash pay Swift. Once I present my protocol, explain to them, what happens with both, right? You have what's going to happen with Swift, and you have what's going to happen with whatever other treatment you do. What the beauty about Swift is, look, nobody's coming into your office. And again, what I'm going to tell you isn't the way you have to do it. It's just the way I'm comfortable doing it. I waive the copays at follow-up visits. So right away, if a patient has a $20, $30, $40, $50 copay, they're doing the math going, well, Dr. Hoxton's not going to take my copay at the second visit, so I'm already ahead $50. And they start doing the math. The other thing they start doing the math about is, if I'm not excising a wart on the bottom of their child's foot, and they're not going to miss dance class, karate, skating, gymnastics, basketball practice, and the kid looks at them and says, Mom, I don't want to miss practice for the next 3-4 weeks because I have a bloody wound on the bottom of my foot, they're going to do it. and it is more cost effective in the long run for them. And I can look them in the face and tell them when this is going to be gone.
Yeah, brilliant. Now, Alan, I want to come back to you on this one as you're a certified coder. How do you explain to patients why Swift isn't covered? What do you say to them when they ask that question?
So, taking one of Alec's statements, not getting too far down and deep into the weeds, because we're not destroying something, and as a new technology, I try to explain to my patients that this is not something that I can bill to your insurance company. But getting beyond that, and I think that's more for the attendees on the webinar to understand, I think what Alec just said is probably even more important for the patients to understand, that we feel more confident in knowing how quickly we're going to be able to resolve the problem, and letting them just look at it from dollars and cents, especially now with copays being as high as they are, and especially making sure they understand that, as Alex said, and I do it exactly the same. I'm not charging them the $30 and $40, $50 copays. I just let them know that this is something that is not going to go to your insurance company. But the one thing that's very good for them to understand is this is still something, because it's still a procedure that's done, this is still something they can use their flexible spending account towards. So people who have that money set aside for any type of medical expenses, Swift is the same thing as contact lenses. Again, you're using it in that same way. And again, that takes that level down a notch and makes them feel more comfortable that they're paying out of pocket, but they're able to get the reimbursement the same way.
Yeah. And we don't have this slide. We can send it around maybe following the webinar, but when you add up copays and you're going to treat a recalcitrant patient, you're talking about 8 to 10 treatments, $50 copays. Your starting point, if they've reached their deductibles, it's going to be $500 to $600. And with Swift, some people charge $200, some people charge $250. We've got clinics that charge $300 per treatment. So your course of treatment, comparably out of pocket, is going to be, let's say, anywhere between $400 and $750 for a much higher rate of resolution without any downtime.
Pete,
out of pocket, you're kind of in the same bracket.
Yeah, Pete, if I may, I was actually at a conference in Michigan, and the doctors were telling me there, well, we get $130 for destruction of the wart, but I said to them, well, you're getting $130, but with what's going on with deductibles right now, and patients having $5,000 and $10,000 deductibles, they're paying that out of pocket anyway. And you're not as confident as the outcome, whether you're paying, if it's $130 and they have another $40 copay on top of that, well, that's $170, and you're not sure where you're going with this. With Swift, I'm much more confident telling them in 2 to 3 treatments, and down the road, when we see that full reaction, it's going to be resolved with much higher level of confidence.
Can I jump in? I know we're on thing, but I'd like to. I always like to say this. When things have lots of treatments in medicine, right? Typically, none of them work really well. Otherwise, you wouldn't have lots of treatments. I would like to put out there and say, this is pretty much going to be the gold standard without question. It is one of those things where, what is the treatment for warts? And the treatment is microwave ablation. So for me, I only offer those other treatments because patients may not want to pay for it. But like I said, after explaining to patients that fact, that this would be the only treatment if you take everything else out of it, take money completely off the table. And I ask you, and I challenge everybody, if money was not an issue and you had an option between something like this, which is non-invasive, does not create a wound with no downtime and no chance of infection, versus all the other treatments, and pick any one you want out there, whether it's prescription medication or, excision or acids, taking everything out, what would you use? Your answer has to be Swift. So therefore, that's why it's going to be the gold standard.
Yeah, no, I appreciate that. Now, TJ, I want to get you involved here just on the cash pay discussion, because I know it's a big part of the equation with Swift, and it is something that I think that is sensitive to a lot of people. What guidance do you typically offer to your physicians on a coaching level when it comes to discussing cash treatment options with your patients?
Well, I agree with Dr. Allen and Alec here. If I can sum up, because the principles that I use, again, influencing and persuasion, it all comes down to patient psychology. They're buying the treatment, they're accepting the treatment solutions, whatever they are. It could be Swift, it could be minimally invasive surgery, could be orthotics, or any other medical equipment, laser. What I hear is that, and then I agree with them 100%, perceived value for patients needs to exceed perceived cost. So when stats, the confidence from doctor, the effectiveness and results and outcome, and then I hear the gold standard and sounds like this solution, when patients perceive this treatment solution that you're offering is the only logical solution for them and for you, then really cash pay, all these things start becoming irrelevant. Doctors already talked about high deductible and co-insurance. So I don't even get that into my head, and I don't even let that into my patient's head. All I'm focusing on is that how can I communicate with my patients that I show them the way to get out of their pain and struggling points, whatever the problems they're having. For me, that's the principle that I use for concierge building, and it works for insurance world because of that high deductible.
Yeah, brilliant. All right, now we might dive into the case studies here. We've got 4 of them to work through, and we'll work through them fairly quickly, but we do want to take some time to show some resolution here. So, Dr. Bass, this is your first one. Tell us about this patient's journey. What are we looking at here?
Yeah, so this was actually the patient that caused me to walk up to you at the conference in Daytona and say,
Right.
give it to me. It was probably the easiest sale you made that day, because this was the patient. So that was in November. So this was a patient that I had been treating since August. And again, this interdigital, and you've only got this one slide, but this patient's got them laterally on the fourth toe, and laterally on the third toe. And while this is just one picture of this exact, there we go. So again, here was the fifth toe. And this was a patient that I was just going round and round in circles with, bandaging the fourth toe, bandaging the fifth toe, bandaging the third toe, different topicals, dealing with it just left and week after week after week. And this was a patient that when he came in for a follow-up treatment, I said to him, I've got something new. I'm going to do this on you this time. And I said to him, I'm not even going to take your copays. I'm not going to charge you for it. This was my guinea pig. This was your case. You put this up as study 1. This was literally my first Swift patient. And 3 treatments when he came back at the 4th month. So the first treatment, the first visit post treatment number 3, on the right, you could see he was completely clear. And this was a patient that was absolutely thrilled with this. I'm actually in the middle of treating treating his daughter right now, and she's resolving as well. So I was thrilled when like all of us who buy these new technologies, invest in new technologies, we say, it's a chance. We see the results and we see what's going on. What's going to happen? So this was another great one that I had, and we only have just a couple of pictures for her. This resolved. Again, this was a young lady who I had been treating for months. And then let's talk about the cash aside for this patient. So this was a young lady who was treating months for we actually had 4 warts. And I said to the parents, this was shortly after I purchased Swift, I said, listen, I think we have to go in another direction. I think we need to really get to the root of the problem and get to what's causing the wart. And I explained that I went through the entire treatment protocol with Swift, that it's going to be out of pocket. And I have to tell you that the father looked at me like I had another head on my shoulders. Like, are you kidding me? I'm going to pay you out of pocket when my insurance is going to pick this up? I said, well, look how long we've been going around and around with this, and we've gotten nowhere. This was a patient that resolved in one single treatment. One treatment. So she had the two. This is her right heel. The first picture we had up there was just behind right by the fourth sulcus on the left. She had another one pretty much near the base of the fifth metatarsal on the left foot as well. And all four resolved with a single treatment. When the patient came back and the dad looked at me, he said, I didn't want to believe it was going to work. And again, when she came back and was clear, it was, I didn't do anything. I didn't debride. I didn't do anything. The body took over after the wart was uncloaked and just resolved.
Yeah, fantastic.
Alec, I'll throw it to you.
So this is one of my cases. Amazing. I mean, 15-year-old girl, you can see, what's going on there under the first MPJ. I mean, I look at it even today, knowing what I did, and I start to think, what would I have done with that? And I guess I challenge everybody who's looking at it to tell me, and I wish I could set up a poll question right now, what would you do with that under the first MPJ in a 15-year-old healthy, active female? I mean, if I excise that, I basically have to denude the entire bottom of her first MPJ. If I use acids, she's going to be crying all night. I'm going to get calls from the mom, and then it's going to spread the virus all over, and God knows where it's going else to end up. Well, luckily, I had Swift in my back pocket, and that's what I did. I took this out. I laid that out for the mom, and I will tell you, I charged $200 for this treatment, and she resolved in one treatment, that patient. And if we went back to it, you could see, that all her skin lines came back completely. There was absolutely no, wound created. It was totally inside out. The body just took it in one treatment. I made, that was a quickie for me right there. So the next slide, which I got a sneak preview of, again, this one's not as impressive, but what's interesting is mostly here is the story. So that wart that you're looking at there under the fourth metatarsal head is a pretty, everyone has seen that wart. It's a solitary wart. The reason I included this is to show you the way the wart goes, what happens when you use Swift. So there's your first presentation. You treat it with Swift. The next one is how the patient presented to me on the second treatment. So that's 30 days later. And the one next to it is on that same day. So I debrided that black area, which is a hematoma that occurs sometimes after treatment. It is non-painful. It's not a wound, but yes, it does sometimes form this small hematoma, which I do tell the patient could happen. What you're seeing there in that third slide is, notice the disorganization of what has happened to the wart. Now, it's still there. It's not gone, but I knew then and there that I had won already. I did treat the patient again with a second Swift treatment, and you can see in the fourth slide, that is their follow-up, and I never did a third treatment on this patient. So that's 2 treatments on that one.
Fantastic, Alec. And we have lots of questions coming in here, folks, so I appreciate that. And our consultants are doing the best they can to answer them. I think they're doing a fairly good job, so I won't post any questions at this stage, just knowing that we will answer some outstanding questions at the end of the presentation as well. So rest assured, we'll try to get to as many as we can. I'll hand it over to you, Pete.
Yeah, great. Just to summarize and to sum up the clinical discussion, Alec, to you first, how many patients do you think you've treated now at this stage? And on the whole, what would you say your resolution rates are?
So how many have I treated? I don't count them, but if I showed everybody my cell phone, it would be very creepy. I have a complete album of Swift before, during, after cases. I probably have done 80 to 90 verruca individual verruca.
Right.
And people ask me, what's my resolution rate? And I feel bad sometimes saying it, but I have one patient that I would consider recalcitrant. And I have told the guys back at Sersha and I've asked him about this, and I know her very well. I know her family. I refer to her as my redheaded patient. She's this, beautiful young, redheaded girl. She's been my patient forever. And she's the only one that for some reason has been a little bit recalcitrant. And she's sweet as pie, totally into it, totally lets me continue on and go on and do it, because one thing that has happened, even though I know that I haven't killed that wart yet, is her pain from the wart has resolved. So I believe that even though I see the wart or signs of the wart, I believe it has thinned to the point that there's no pain there anymore. So she's happy. I'm just, a perfectionist because she's killing my perfect record. But I don't have a wart yet. I haven't killed with it.
Fantastic. And no one's come back with recurrence.
I don't have any recurrences. I don't.
Okay, that's great, and that's consistent. This data we referenced at the start end was less than 1% recurrence. That's from a 13,000 post clinical follow up that we did recently in the UK. So
you're saying that I have 80 to 90. So as soon as I approach 100, I'll get my first recurrence. Is that what you're telling me?
Yeah,
great.
Less than 1%. The zeros after the point are yet to be disclosed. But no, I appreciate that. So really, to support the claims that both Alec and Alan have made, patient satisfaction through resolution really is what fuels any SWIFT program. What we always come back to with SWIFT is that it works, and this is the key. We can talk all we want about marketing programs and whether it's cash pay or covered, but at the core of it, are you solving a problem? Is it actually working? And that's really the key thing behind SWIFT. Now, ultimately, there's nothing more powerful in private practice than a referral. So if we can go to the next slide, Andy, we'll just speak to some of the stats we're seeing on the patient satisfaction side, and the referral stat is the one that really jumps out at me. And when you start to think about, when you have that kind of a quality experience, especially for some of the stories that we're hearing tonight about people that have had, lesions for years, the clinical study, which we'll share with everyone after in our follow up, the average age of these lesions was 5.3 years. When you think about having, that kind of impedance to lifestyle for that long, you can see why people are willing to refer other patients on when they get good results. And that's great. We're thrilled that we're getting good clinicals, and that's the most important thing. Biggest takeaway from today, if that's all we're going to get, is that we're getting some fantastic clinical results. But we do want to talk about how we can be profitable with SWIFT as well. So how does this translate into practice profit? So if we can go to the next slide. For a lot of people, their current modalities, you think about what you're using now, those current modalities don't require an investment in capital equipment. That's a big factor to consider. Also, being a cash pay modality, how many patients are going to say yes? It's something that we've already talked about, but it's a question for many. All really valid questions, and all questions that we will answer as we dive in. So we're just going to share some financial slides with everyone just to explain sort of the profitability behind SWIFT. But Chris, I'll hand it over to you to walk through these and just explain what we're seeing on this slide.
Sure thing. Thanks, Pete. So when it comes to the financial model, the most important illustration is not SWIFT in isolation. You have to compare it to what you could have made if you were billing 17110 using traditional destructive methods, which is the side-by-side comparison we've created in this first table. You'll see in those first two columns on the top table. Now, this input data was pulled from 100 practices we've connected with over our first year of operation. We averaged treatments per patient and reimbursement values to provide an annual forecast of $8,295 in profit contribution using traditional destructive methods. On the right side, you'll see SWIFT at an annual profit forecast of $28,446, and that's after paying your monthly lease payments for the equipment. Now, everyone's practice is different, so I don't want to get overly caught up in specifics, but as the financials highlights suggest, the model is certainly robust. As an industry standard, Anytime you see a forecasted payback of less than 12 months or so on a specialized medical device, you're doing very, very well. Next slide. Now, we talked earlier about the concept of revenue per hour based on treatment times of 10 minutes. What you can see is that Swift, you're moving away from doctor exhausted, thankfully, and you start your transition towards doctor relaxed and happy, or doctor crushing it in terms of revenue per hour. Now, in this slide, we move away from averages and forecasts, and we turn to real-life examples with data taken from 3 of our practices during their first year of operation with Swift. We purposely picked 3 practices that operate in different pricing and volume tiers. As you can see, practice 1 in that first column operates at a price point of $200 per treatment, which is quite normal, but has lower than average patient volumes at just under 2 patients per month. Practice 2, on the other hand, is operating just below our average utilization at 3.7 patients per month, but has increased pricing levels to $250 per treatment, which we see very, very standard across the country now. Lastly, practice 3 sees significantly higher volumes at just under 6 patients per month, so still not a crazy amount of patients, but reasonable, and charges $300 per treatment. A couple of takeaways come from these case studies. Number 1, even at very low volumes, Swift is still very much profitable. And again, these profit numbers are all after paying the monthly lease for the equipment. I should state here that you can buy the system outright, which is an option, but for a variety of reasons, most people choose a 5-year lease. The second takeaway is that pricing matters. And here is where you can see how refreshing it is to be able to control that pricing level, to TJ's point, to reflect the value of the patient outcome and experience. The final observation I want to make is that marketing is hugely important. And those that invest in marketing and promotion will see significantly higher returns than those that do not. Now, there are several questions that have come up around investment criteria and patient acceptance, and I want to turn this back to our panel. One of the questions asks, the model looks great, but they ultimately all come back to what percentage of your patients will pay. How many are actually paying the $200 to $250 per treatment? And Alec, I think you addressed this, but if you could just reemphasize what you're seeing with your group.
I'm converting, like I said, about 85% of my patients who come in with warts, once it's presented, 85% go with Swift. That's what I'm seeing. And I'm trying to get it higher than that. And I don't push. I'm not pushing. I'm merely educating the patient. You know, at the end of the day, I'm sorry, go ahead.
No, I was going to ask, did you see, and we see this fairly commonly, Alec, did you see your confidence level go up after a few treatments and then see your acceptance rate rise accordingly?
Yeah, no question. And it's kind of when I started saying earlier is again, because I was so early on it, I didn't have, let's just, call me Uncle Alec for a minute, like I didn't have Uncle Alec to go to. So I had no, I was just going with you guys, right? I was going with you, I was going with my sales rep, and I was hoping you guys were right. And so I in the beginning, I would call it my first 2-3, I was selling because I didn't know. But once I saw the results, and that's what I'm hoping to give everyone watching is you don't need to have that, to be timid about it once you dive into it, because I'm telling you, and I'm a general podiatrist, and you'll see me at a conference, and I don't want you to walk up to me and tell me that I was lying to you in any way, shape, or form. I am telling you, it is the most effective treatment that I have used on Verruca. And probably, honestly, as far as equipment, and I buy all types of equipment from my office because I like the toys, it's probably my most effective piece of equipment in the office.
Fantastic. And Pete, before I hand it over to you, there's just one other question we got in regarding lease options. Can you defer payments during this pandemic? And the answer is absolutely. We have many finance partners that we work with. We are offering 6-month deferred payments, so no cost for capital for the first 6 months, which would, as an example, if you were to purchase a unit on May 1st, you wouldn't pay anything until November 1st. hopefully that answers the question. Pete, I'll hand it over to you.
Sure, no, it's great. So we might just shift gears here for the sake of time. And we'll start to shift a little bit towards the marketing side of our program, because it's something that is really critical. So as we've highlighted in the financial slides, one of the keys to the Swift model is patient flow. So you'll see the difference between 2 and 6 patients per month is quite dramatic. So finding the patients that are seeking better treatment becomes the key to this. And this is where our marketing partnership really comes in. Again, I'll try to keep this brief, but our data suggests that only 10% of those with warts, those people with warts, will actually go and seek treatment. So for us, we view this as both a challenge and an opportunity. It's a challenge because, as the clinical studies and the content online suggests, and suggests accurately, that resolution rates through treatment and destructive treatment are not much better than placebo or the do-nothing option. So guess what? Most people do nothing. In fact, 90% of people do nothing. So it's an opportunity for us for the same reason, because we can unlock that 90% by providing hope through better outcomes and resolution. We're giving people a reason to take action versus do nothing. So it's going to be a process. We don't think we're going to be able to get there overnight, but as the financial slides show, the fight is certainly worth fighting. So here's a screenshot from our patient-oriented website, warttreatmentinfo.com. Here is where we go after those who are self-diagnosing. So we host this website. It's a place where people go to figure out what type of wart they have, what treatments are available, and then where ultimately to find Swift treatment. So the moment someone invests in Swift, we place their location on the map and we launch our campaign. And here's how we do it. So if we can go to the next slide, we'll just show an example of a campaign. And I think actually, Alan, this is your area. So this would be an example of a 10-mile radius. And here's how it works. We tell Google that we want to put our ad up every time someone types in our most common search terms. So we rank for 28 terms, including effective wart treatment, get rid of warts on foot, et cetera, et cetera. So as you can see from the data, within the past 5 months for this location alone, there have been between 500 and 1,000 searches per month within this region for those search terms, which indicates a huge unmet need. People are seeking effective treatment, and for the most part, they're not able to find it. So our click-through rate comes in at 7.5%, which might seem still low. It still seems low to us. We'd like to get that up. But as you can see, we're more than double the industry average. So still early stages of this program, but as of now, we're using this tool to send through enough patients to cover at least monthly lease payments on the system. And our aim is to ramp this up significantly. Now, I'm cognizant it's getting close to 1 hour, so I want to be super clear on time and respectful of time. We have a little bit more content to run through. So for those of you who are willing to stay on, we would appreciate it. We've got probably another 10 minutes or so, 5-10 minutes, and then we'll ask questions. So we'll stay on as long as people want to stay and ask questions. But we did want to give you the opportunity to request more information or to book a demo if at this stage. You'll see Andy's put up a button or an option for you to request a demo. So if anyone at this stage is interested in exploring Swift in more depth, in more detail at any level, click on the button. You can go there and request a time that works well for you. You just have to put in your contact info. We will reach out to you and we'll either set up a live phone call, an in-person meeting, or a video call. So I really encourage you to do that.
Hey Pete, can I just chime in really quickly about what the marketing is about, especially when they do find you on the map. If Andy wants to go back one slide, what's great is it drives them directly. You work directly with the practice to build a page that can be built into their website. So that's what's great. They click on when somebody finds me at Central Jersey Foot and Ankle Care, and they click on it, it drives them right to my website. So again, it's this great marketing effort that's going on between both of us, between Saoirse and our website and my website and my practice. So I think that's important. They just don't get a phone number here. If you see on the left side, you can click on visit website, and they're going to go right to your website. So they're going to learn more about you than just about Saoirse and wart treatment. Another great thing that you're working with the practice.
I appreciate that.
Fantastic. And I'll just draw your attention quickly, guys, to another poll question. It's asking, do you currently invest in PPC or Google AdWords advertising? If you don't mind having a look at that, that's great. Now, Pete, a question came in just about tip pricing, and I thought you could tie it in nicely to our marketing partnership and how that works.
Yeah, absolutely. So yeah, both are sort of intrinsically linked. So for those of you who don't know, tip that was shown during Alex's treatment, that's a disposable tip. It's a $65 tip. And that cost of that disposable, you can sometimes pose a challenge to certain people, but the reality is it's that tip and it's the incentive behind that tip that creates this partnership. So once people understand that we are intrinsically linked through both the sale of tips and the promotion of patient treatments, you start to really understand why this becomes a true partnership. So what we do when we're talking about PPC advertising, this is a cost that we bear. So we invest hundreds of dollars each month on behalf of our partner clinics, our Swift treatment centers, we call them, to help drive that patient flow. Because every time you see a patient, it's good for you and it's good for us. So that really does create this, what we call this true partnership. It's not just that we're nice guys and we want to invest in PPC dollars to help grow your practice. We're certainly motivated to do that. So that's how we fund, these programs. It's how we fund the partnership, and it's what makes sure we're not just another laser company that drops a piece of capital equipment off and you never see them again. We are there to help train you, to educate your staff. Your success is our success. So it really is a true partnership. Does that answer the question, Chris?
Yeah, that's great. Thanks, Pete.
Yep. Now, I just want to throw this just quickly to TJ. TJ, in our limited time together, I've been very impressed with your overall grasp on digital marketing. We focused in on PPC here, but just for the benefit of the rest of the group, as you prepare to launch Swift in your practice, what platforms are you planning to use to promote the treatment?
Yeah, thanks, Pete. So PPC is great. I mean, most doctors know there are many different types of marketing: branding, words of mouth, referral marketing, online, offline, But what I like about this style of marketing is called lead generation marketing through a concept called funnel. So basically, typical PPC or Google search AdWords, that type of marketing is great, but it's hard to track the potential patient's behavior. It's more, in a way, passive. You do still increase, the eyes to your site through PPC. However, if you know and understand and implement that tracking is ethical, okay, it's all legal, ethical. You through Facebook Pixel or Google Tag, once you start applying this lead generation marketing, it suddenly becomes from shotgun approach to more laser focused, like sniper approach, because you can now track behavior of potential patients. You can track for website visitors. You can track for video viewers. So then what you can do now with less ad spending budget, you can retarget your intentional ads shown to these people through omnipresence, through Facebook newsfeed or Instagram or YouTube channel, or even Google ads, like it's called display ads. So when you watch like CNN.com or different website, suddenly the corner or, along the sideline, the things that you are familiar, it starts showing, so like those type of marketing is basically called funnel marketing, lead generation marketing through Pixel. So what I like to do, again, it's limited time. I cannot tell you everything. I'm going to basically run what has been proven to me and my doctors that I'm working with. I'm going to run like the funnel marketing, lead generation marketing, build audience, and then I'm going to retarget people who have visited and checked out Swift technology, bombard with the educational material, social proof, which is like testimonial videos before and after. So they're going to keep seeing your ads relative information to what they're interested. So it increases and maximizes people to book an appointment for your practice, and also pre-educated and qualified. So when they come to your door, it gets even easier to talk to them and get them to accept this treatment solution. I have no doubt. I'm just waiting for the next couple of weeks until this Swift comes in. I'm going to create a nice ad campaign out of this, and then start running video ads, and then, start sending them to my funnel, and then I'm going to retarget them. I know they're going to come. And, again, based on this specialized and proven niche, that's what is differentiating for me. I wouldn't recommend any of you to spend money on low-hanging fruit treatment solutions. I mean, anybody, neighborhood podiatrist, if they can do with what they have, it's not worth marketing, spending marketing budget. But like this, I mean, even if I haven't used it, I kind of have strong confidence this is going to help differentiate my practice. And then I have this something unique. I told you earlier, you got to be adapt to the new environment of cash pay, or, the in-office procedure, cash pay, especially this pandemic. People they're scared to go to hospital. They're scared to go to big, especially virus, immune, people are hypersensitive to these terms now. So I wouldn't wait, as soon as I wouldn't stop marketing. I mean, I would do it now. And then, we can help these patients with this very unique niche. And that's what my marketing strategy. Hopefully I didn't go too fast.
No, that's great.
No,
Fantastic.
honestly, I'm blown away every time you talk. And for anyone who found that to be slightly overwhelming, don't worry. What we're going to do is distill down all the notes from this webinar, and we're going to send it out as a follow-up. What I also want to do with TJ when we go live with his program is follow through some of the best practice steps that he does take, because he is a brilliant marketer, and we will share that with our community.
Oh yeah, for sure. I'm excited to share. I know I'm going to create a nice case study out of this, because I sell $4,000, $5,000 minimally invasive cash surgery. For me, $250 to $300 per treatment with 98% efficacy. I mean, you have a proof, you have a simple in-office, no anesthesia. It's got all the ingredients, to provide the best solution when it comes to work. So I 100% believe what Dr. Alex says and Dr. Allen says, gave me even more confidence to go for this.
Oh, that's great. I appreciate it. Now, I'm going to touch just very quickly on this slide, and it ties into PPC advertising in terms of how we can start to shorten the patient journey that we talked about earlier. But really what I want to just quickly highlight here is the work that we do from a partnership standpoint on the referral end. So when we surveyed patients, what we found is their typical journey goes primary care to dermatologist. More people were going to dermatologists for plantar warts specifically than they were to podiatrists, which we originally found confusing, didn't quite get it, but it's true. The data that from all the clinics we've surveyed is supports that. So what we're finding is dermatologists are in fact more frustrated, or just as frustrated as podiatrists, and are very willing to refer out patients. So this becomes almost step one in our implementation plan around in line with education. So what we do is prepare promotional packs to any local dermatologist on your behalf, and we go out to them and we alert them to the technology that you are now bringing to the community. So what we found is dermatologists are more than happy to refer those patients off, and it actually proves to be a fantastic way to kickstart patient flow. So just wanted to highlight that there quickly. We'll move to the next slide then, if that's okay, Andy. And really just want to summarize. So I know we're 10 minutes over time, so we're going to try to bring things together here. And before we do so, I just want to ask the panel, final words of wisdom. Alec, to you, what advice would you give to anybody on the webinar who's sort of contemplating an investment in Swift?
Listen, for me, it's always about wanting to set yourself apart. If you want, average results, then you stay with the averages. This is not something average, but I think this is going to be the gold standard. I'm glad I got involved early. I still think it's early. Who took the time to be on this call is an early adopter, in my opinion. I mean, you're within the first year of this thing rolling out. You are early on it. So I say, don't hesitate. Contact these guys. And hey, if you have anything, I am easy to find. Google me, reach out to me offline. I'm happy to chat, talk, and we can do that.
Awesome. And Alan, for you, maybe to frame the decision another way, why now versus later? Maybe that's, it's a question for a lot of people. Is now the right time? It doesn't have to be this week. I'm just saying, this year versus, waiting. What would you say to that? Sorry, Alan, I think we've lost your audio there.
Sorry, I had muted myself. Am I back there?
You're back.
Okay, sorry. I've seen results. That's what it's about. So I have the utmost confidence that Swift is definitely going to be the gold standard moving forward, because it's not just another way to kill a wart. It's not just another topical treatment or anything else that we're going to do. It's getting to the root cause. It's about uncloaking that HPV. This is the biggest game changer I've seen in treating warts. I'm in practice, 26 years. In 26 years, there has not been anything that's treated warts any differently other than Swift. So I wanted, as Alec has been saying, and as TJ is saying, I want to be the one that's the one that's going to stand, head and shoulders above the next podiatrist who's just using the same old treatment in doing this. For me, I want to be the one who's going to be very confident to say to my patients, I feel comfortable in saying in 3 treatments, we are on the road to recovery. And while it might be a 6-month full treatment effect, I feel more confident in using Swift than any other treatment modality right now, whether it's excision, whether it's canthrone, whether it's acid, whatever it might be. This is really the biggest game changer out there. And I there's nobody else in my area that's doing anything like this. And that's how I'm putting myself head and shoulders above any other podiatrist in my area. And that's really what it's about. Right. And I'm gonna leave with one thing. And I've been thinking about this as we've been going through tonight's presentation. For not only the doctors on this call, but think about this as what you would tell your patients. Think about Swift as an investment. It is not a cost. You are investing in your practice. This doesn't cost your practice a thing. It's an investment in your practice, and you talk to your patients in the same way. It's an investment in their foot health. It doesn't cost them anything. It's investing in their foot health more than anything else. So think about the word investment and not cost. I'll leave it there.
Yeah, I love that.
Fantastic.
Now, Chris, any final questions we wanted to take from the audience?
Do you know what? There's been some great questions, Pete, but the consulting team has just been flying through the answers. So I think we've answered most of them. One question did come up. How do you go about buying a system? I'm happy to field that. I mean, there's a number of ways. One is what we had suggested is the book a demo, but you can go to our website, eSersha.com, and ask to request to book a demo, and we'll have someone reach out to you and give you all of those specifics on how to acquire a unit. And I think that's it, Pete.
Super. Okay, so I'll wrap things up, and I'll just talk about what's going to happen, following this. So immediately following this webinar, you're going to receive 2 emails, one with the link to the replay in case you feel like watching it again. Wouldn't blame you if you chose to. Secondly, you'll receive a link to the book a demo, which Chris is referring to. And really with that, again, we're just providing you an opportunity to dive deeper and set up a meeting or a phone call, whatever you prefer. In addition to that, we're going to be raffling off 5 free copies of TJ's book to anyone who does book a demo. And then lastly, you'll be getting a summary email from us with the answers to the questions and the key takeaways from tonight's presentation. So that really brings us to the thank yous. So firstly, thank you to the panel. Thank you all so much for being here tonight. And more importantly, for being such an important part of our community. We appreciate everything you guys do for us and for your patience. So thank you all very much again.
My pleasure.
And lastly, thank you to the audience for not only investing the time on a Wednesday evening, but for being so engaging. It really does add a richness to the discussions. I love hearing that questions are being tossed around it, that we're engaging. So I hope everyone got something out of tonight, and thank you very much for being a part of it. We really look forward to working with you. We really look forward to welcoming you to the Swift family. And perhaps one day you'll feel compelled to perhaps create your very own Swift avatar. Dr. Hochstein, I promised I wouldn't share this, but I had to. If anyone can zoom in, I'm not sure if you can, but this is actually Dr. Hochstein's face within this photo. We reference that we do call him the Wart Wizard. And just as a precursor, this came to us about 2 hours ago. So Alec, I commend your preparation for tonight's presentation. I like that you were focusing on the right things. And this for me is just a really strong indication that I think we can all just can't wait to get back to seeing patients again. But no, in all seriousness, really appreciate the time, everyone. We're going to leave you with this one quote from Stephen Covey. To achieve goals you've never achieved before, you need to start doing things you've never done before. So let's use tonight as our launching pad, and let's go make some waves. Thanks for joining, everyone. Have a great night.
Thanks, everybody.
Thanks, everybody.
Thank you. Thank you.
Thank you, guys.
Have a good night.
Take care.
Bye-bye.
Bye-bye.